Hello, my name is Karina. I work with parents to support their breastfeeding journeys. Breastfeeding takes practice, and you and your baby are learning together. The main goal is to get your baby well attached so that you feel comfortable and they get all the milk that they need. There are different positions you can try with your baby, but any position you try will have the same basic pattern. So to get your baby attached, you'd aim their nose opposite your nipple. Allow their head to tilt back so that the nipple brushes their top lip. Wait for the baby to open their mouth wide, then quickly bring them to the breast with their chin leading. This way you'll get a deep latch, feeding will be comfortable and your baby can get all the milk that they need. Speak to your midwife or health visitor or visit beside you for more advice and support, including details of your local breastfeeding support drop-ins. Laid-back breastfeeding is when you use a comfortable, reclined position to feed your baby. It's a lovely way to start breastfeeding, and you can do this anytime. It lets your baby use their natural reflexes to get into a good position to feed while giving you lots of skin-to-skin time together. Prop yourself up with cushions on the sofa or bed and place your baby on your front with their tummy resting on your tummy. You can move baby slightly to the left if you find that more comfortable. Make sure you are upright enough to look into your baby's eyes. While supporting your baby, guide them towards your breast with their nose opposite your nipple. They'll naturally have their body in line with their head free. Their instincts will help them root around and attach themselves with a little help from you. Underarm is very useful if you've had a cesarean, if you have large breasts, or you feed twins at the same time. Sit with a cushion along your side. You might need more than one to bring them up to the right level. Tuck them under your arm with their hips close to your hips. You want their feet to be resting along your back with the soles of their feet pointing towards the ceiling so they can't push against the chair. Your baby's nose should be level with your nipple. You may need to move them further around your body to get into this position. Support your baby's neck with the palm of your hand. Make sure their head is still free to tip back. Gently guide them to your breasts, leading with their chin to encourage that large mouthful of breast. This should also encourage the nose to be free. Once baby is latched, you may want to position a rolled up blanket under your wrist to help hold the position. This is for it to be sustainable. Feeding lying down can be useful at night. Practice during the day to help you feel more confident at night. Check out the safe sleep information from the Lullaby Trust and about safe co-sleeping, as it's always best to be prepared. Lay on your side and position your baby against you, tummy to tummy. Make sure baby's head and neck are in a straight line. Pillows behind you and a rolled up baby blanket behind your baby can support you both, but remember to remove the baby blanket after you've finished feeding. If you've got a pillow under your head, make sure it's not too close to your baby's head or face. Tuck the arm you're laying on under your head or pillow and use your free arm to support and guide your baby's head to your breast. A thin pillow or folded towel under your ribcage will lift your body slightly, and this is helpful if you have large breasts to get the correct position. Remember to put your baby back into their cot after feeding. Breastfeeding multiple babies can bring challenges. Twins and multiples can often be born early or small, and they may need a bit of extra time and support in the early days. The underarm position can be useful for feeding twins. Some parents choose to breastfeed their twins one at a time, but it can be useful to have the option to feed both babies at once. Positioning them with the help of pillows or a tandem feeding pillow can help, so you'll have a hand free to then latch the other one on. It can take time and confidence to get tandem feeding going well. The size of your breast, whether large or small, shouldn't impact your milk supply. It can, however, mean you may need to try different positions to find the right one for you and baby. Feeding with larger breasts can be more challenging, so it's important to find a position you and your baby find comfortable and sustainable. Laid back and rugby positions can be useful for women with larger breasts. Please see our attachment and demonstration videos for more information. You may need to support your breast with your free hand to take the weight of your breast from your baby's chin. This allows them to breastfeed more effectively. C-hold. Support your breast with your thumb on top away from your areola and the fingers underneath. Your fingers should also be well back from your baby's mouth. This hold is helpful when breastfeeding in the rubbery position, as well as the cradle position. U-hold. Place your fingers flat on your ribcage under your breast, with your index finger in the crease under your breast. Drop your elbow so that your breast is supported between your thumb and your index finger. Your thumb should be on the outer area of your breast and your fingers will be on the inner area. This hold is helpful when breastfeeding in the cradle position. Some other tips to try to support your larger breast when breastfeeding is to use a rolled up muslin, towel or thin blanket under the breast to support and lift it so you can better see baby's latch. Sitting cross-legged and having pillows on your lap to hold baby means you can support the weight of your breast when feeding. If you can't see your baby at the breast, sit side onto a mirror to look at the latch. A shallow latch means your baby isn't taking a large enough mouthful of breast tissue into its mouth. This means your nipple is too far forward in your baby's mouth and so it can rub on their hard palate, which can cause pain and damage when feeding. It is important to wait for your baby to root for the breast so they open their mouth really wide before gently guiding them to the breast to latch. If this isn't working though, you may need to give them some help, and one way to do this is by using a technique called the exaggerated latch or flipple. Hold your breast and shape it so that your nipple is pointing up against your baby's nose. Shape your breast like a hamburger in line with the baby's mouth. When shaping your breast like a hamburger, the piece that they will take a bite from needs to match the position of your baby's mouth and lips. Wait until your baby roots for the breast and opens their mouth wide. It is helpful for your baby to feel your breast with their lower lip or chin. At that moment, guide your baby to the breast with your other hand. Flip the nipple down into your baby's mouth and they should take the breast into the mouth leading with their chin. They will take the underside of the breast tissue and latch. Once latched, you should notice that your baby has a much bigger mouthful of breast tissue and that you can see much less of the breast and areola. Breast compressions is gently compressing the breast during a breastfeed, so that it increases the pressure on the milk glands. This causes them to release more milk and it increases milk flow. It stimulates the milk letdown. This keeps baby feeding actively at the breast for longer and may help to increase the milk supply by making sure more milk is emptied from the breast. First step is to get your baby into a comfortable breastfeeding position with a deep latch. This means plenty of breast tissue in the mouth as well as the nipple. During the breastfeed, you are watching for the moment your baby stops actively sucking. This means the deep jaw movements will slow down and you won't hear many or any swallows. Take your free hand and use this to cup and compress the breast between your thumb and fingers. You need to place your hand far enough behind the nipple and areola as you don't want to disturb your baby's latch. You need to, however, be close enough to apply gentle pressure on the milk glands. You do not need to slide your thumb or fingers along the breasts, and you do not need to press so firmly that it is uncomfortable or painful. Your baby will start sucking and swallowing again as the milk flows due to the compression. Maintain the pressure while your baby is still sucking and swallowing, and then release the pressure and rest your hand when your baby pauses. Keep repeating those compressions until there is no active sucking or swallowing. You can then offer the other breast and then repeat the breast compressions as needed. Once breastfeeding improves, you won't need to use breast compressions. A baby breastfeeding effectively, often, and milk being removed thoroughly tells your body to make more milk. If breastfeeding is going well and your baby is getting enough milk and gaining weight, you don't need to use breast compressions. There may be times when you need to express your milk. If you are separated from your baby, if you're trying to increase your milk supply or to relieve any engorgement. Some women may hand express colostrum before their baby arrives. Expressing by hand is a useful skill to have and can help encourage your milk to flow from a particular part of your breast. This may be useful if one of your milk ducts becomes blocked. First, wash your hands and make sure the container you use to collect the milk is sterile, and make sure you're feeling comfy and calm. There are ways to prepare your breast to help your milk to flow. Holding your baby skin to skin or lightly dressed helps to raise oxytocin levels, which helps trigger your letdown. Looking at your baby or a photo of your baby or something that has their smell can also be helpful. Gentle massage using gentle stroking, rolling, kneading and tapping movements with warm hands is a great preparation to express. Place your fingers and thumb around the breast, behind the nipple, in the shape of a letter C. Feel for the change in texture of your breast. Your fingers and thumb begin to come together while also pushing back slightly into the breast, going towards the chest wall. Bring your fingers and thumbs closer together to gently express milk. Then relax your hand to release the pressure on the breast. The steps are repeated in a rhythmic pattern. Continue to hand express until the milk flow slows down. You can then swap to the other breast. If you have larger breasts, you may find you need to use both hands per breast. The exact best point of where to place your fingers is individual to each mother and trial and error, so don't be afraid to adapt this for what works best for you. Visit Beside You for more advice and support, including details of local breastfeeding support drop-ins.